What I want to cover today is probably one of the most important aspects of the entire Academy of Chiropractic, including, whether you're working with medical doctors or spine specialists or hospitals, what the common link between all this is, because we know that our audience may vary from time to time. But what is it that gets their attention? Because remember, what we want is to understand. Why is that not working? Hang on 1 second. Don't think my pen is working here. Let's go here. Something could be going on here. 1 sec. One second. Everybody's last minute with texting me. I can't get on. Yes, Ryan, they're number 3 on the patient portal. Just look down until you see weekly webinar period. There was 2 other videos posted on top of that. You can be a doctor, but you can't find a website. All right. Why is this not? That is really weird. Sorry, guys. Give me 1 second here. I don't know what is going on. Why it's not. What I want to talk about really is about being the best of the best. And that's the common denominator between whether you're going to increase successfully throughout your career, you're going to peak and then hit a valley, regardless of whether or not you're getting your patients from social media, you're getting your patients from medical doctors, or you're getting your patients from hospitals, or you're part of a large group, whatever it may be, it doesn't matter. What matters is that you continually increase your expertise and you do it in a format that matters. One of the most critical things that has plagued the chiropractic profession since our inception was just crap CE. Going to some big convention, signing your name and going out skiing or swimming and blah, 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 all that crap. Like, you could do that in your own free time. But our CE never really ever produced directly any sort of results or referrals. A lot of doctors took courses in the hopes that it would promote things, but nobody knew outside of chiropractic, nobody knew what the hell any of that was. Nobody knows what a diplomate is. Or if you have a diplomate in rehabilitation or orthopedics, great. Like, what did it really give you? You had no clinical rounds. There was nothing clinical. There was no MRI interpretation. There wasn't any triage. I went halfway through the orthopedic diplomate and basically was just a glorified review of orthopedic tests. And it was all given by people that, had an interest in the science that was behind it, but they weren't developing and building any major practices. They weren't, working at a high level. So it was a lot of BS. So when it comes to your credentials, just getting the credentials themselves isn't enough. You have to have a process to get that out into the community and to teach people what you have and what you're about. And we do that through 2 major ways, right? Number 1 is we do it through our clinical practice actually calling a primary care MD and saying, look, this person's got a 10 millimeter abdominal aneurysm. Or, hey, listen, I don't think this leg pain's coming from the spine. I think it's vascular. I'm going to send the patient down. Clinically demonstrating your expertise, sending a patient with spinal cord compression from a cervical disc herniation to the surgeon. Okay, identifying these things and being a real player. Okay, and this is where we're getting with our profession. The doctors that are doing this in my program are cleaning it up. But you have to be good and you have to be sexy on paper. Okay, that's the key, because medicine in particular vets people through that clinical expertise. They know when patients come back as they ask them, what did Dr. Owens say is wrong with you? What type of exam did he do? Did he hit you with that little hammer thing? Did he scrape your skin a little bit? Did he ask you questions? Oh, no, he didn't do any of that. He just put me in a room and I watched a 3-hour video and then he had me lay on my side. Okay? That's the difference, is being a clinician, number one. Number two is building your curriculum vitae, building your expertise, talking about MRI, talking about different credentials, and promoting those to the community by visiting people, introducing yourself. Remember, the medical community is a networking community. Every medical specialist that I've ever met has no problem with going out and talking about where they were trained. You were trained to the Academy of Chiropractic. Those courses, that's MRI spine interpretation, is co-credentialed between medicine and chiropractic. That's a big credential. Okay, being a trauma team member, which we're going to get to in a second. So being able to work towards something that's going to elevate you is critical. But just getting it for the sake of getting it and sitting in your office and wondering why you're not busier, that's not good either. Every chiropractor has anxiety about going out there and meeting people at some point in their career. It may be early on, it may be now, but you have to just keep continuing to do it. Where you want to start looking for the long term. And again, there's a lot of major things happening with what Dr. Student and I are doing. And this all came out of that meeting in New York last week. What I'm telling you is that the trauma team is your first focus. Once you become trauma team, then you can work with me on the fellowship. The fellowship and the trauma team people are going to be the offices across the country that we work with first. Okay, and that's because we can rely on the fact that you guys and ladies all know what you're doing. And that not just that you can do it, but that you can communicate it. That's a key component to this whole process. Are you out building relationships plus having the expertise internally to be a good clinician? So when we have this, let's look at membership requirements for the trauma team. Right, so this is a trauma qualified provider, and this is in the content in these programs are backed by Cleveland University, Kansas City Chiropractic and Health Sciences University, as well as the State University of New York at Buffalo Jacobs School of Medicine and Biomedical Sciences. That is the key. Those are the bookends, right? I know I'm saying that word a lot. This is the key, but it is, and it's a big key. But you have credentials in both chiropractic and medical academia. Nobody can throw you out of a courtroom. Nobody can throw you out of a clinic because you're trained just like the medics. You're trained just like other expert providers. All right? So whether you set out to say, hey, I'm going to be a trauma team member, or you're setting out to say, listen, I need to have some additional training in spinal biomechanical engineering, accident reconstruction, head trauma, whatever it may be, it's okay to need additional training. That's the point, right? We actually have requirements to obtain continue training. But when you talk to medics, make sure you use that term, training. But if you're going to work for continuing education courses and you're going to spend your money, spend it for something that gets you toward an end result or an end goal that's going to validate your expertise. When it comes to understanding the fellowship, the trauma team member is the person that has completed all of the didactic coursework without the clinical component. That's the part that Dr. Student handles. My component of the fellowship is the rotations and the research. That's what I'm good at. That's what I handle. And I also help you work through and build relationships with the medical community in your area. That's an important component. It doesn't make sense for you to fly to a different part of the country, build relationships, back to nothing at home. So when it talks about the required course, triaging the trauma patient, MRI spine interpretation, spinal biomechanical engineering, spinal trauma pathology, accident reconstruction, impairment rating, head trauma, which also includes traumatic brain injury, medical legal documentation, and that's going to teach you all about Colossus and the Colossus algorithms and understanding why certain things go in your documentation and are important to help your patient, and why other things, when you write them in there, are detrimental and they're harmful, and how the computer reads this information. Okay, remember, we're dealing from a claims management perspective. We are dealing with artificial intelligence. We're not dealing with a human being. Okay. Traumatic brain injury, very, very important stuff. Do you know how to examine somebody with a brain injury? Right? It's not just cranial nerves. Do you know how to image them? Do you know how to clinically correlate symptoms? Do you know how to document that? There's an EMR macro for that. Okay. Medical legal documentation, again, like Colossus, I can't overstate that enough, particularly on low-speed injuries. Okay, low-speed collisions, automobile accidents, those are fought in the Colossus region, not at court. You talk to any lawyer, they'll tell you that it's extremely difficult to convince a jury that a car with minimal body damage is going to result in a permanent long-term impairment. Now, it happens, and the research shows that it happens, but we're not dealing with science in the courtroom, you're dealing with jurors. Okay? So the way that you win on low-speed collisions is at the beginning in the paperwork, and that's what Colossus is all about. Orthopedic testing, stroke anatomy, and evaluation for chiropractors and manual medicine specialists. Super important, okay? There's a vascular neurologist that goes through how to evaluate properly, and how to work one of these cases up, and how to recognize it. Number 10 alone will save most of our licenses at one point or another. Okay, it's critically important. You're not learning from a chiropractor, you're learning from a vascular neurologist. Okay, these are people that are operating at the top of their game. That's what the academy is really all about, is not providing or developing continuing education because, hey, I've been around for 20 years or 30 years or 40 years, listen to me, because I have experience. That's all bullcrap. That's what chiropractors have been doing for 120 years. What we need to do is bring the top experts, the best of the best in those fields, and bring them in and have them teach all of us so that we can learn from them. And that's the key. You have to pass each course with an 80% or above, and then you can click on an application. Okay? You can put the trauma team, active trauma team member on your signature line of your email. There's a press release that you can click, and then we can disseminate this to MDs and attorneys. So let's look, let's go back here. And let me just show you the current team members, okay? Now, we have about 38, I think with this new class, maybe 42, 45, something like that, in the fellowship program. think there's like 118 active trauma team members. This is going on with or with you. But if you look at your state, what's going to start to happen is people are going to start receiving these credentials, and that's where the standard is going to be set. Just like when I say, hey, listen, if you want to have the best of the best documentation, look at the clinic in your area that has the greatest. Carolyn, I think you're on here today, and I don't know who else is on. There's a couple of you other on here, but anyway, find the clinic that has the best reputation and copy the format of their notes. Okay, look to be the best of the best. And this is the pathway. Start your continuing education. And what you can do that on is looking for each step of the way to build towards something. Invest your money. Let's see. This is where we want, this is where you go. Okay, so after this, you're done watching this video, come to the CE University. Dr. Student and I spent about 6 years building this. And it's not so important what's going on and hear what you see, but in the background. Okay, so I can come up here and I could see New York. And by the way, if you have credentials and you want to teach and you want to create continuing ed courses, okay, you have to have the credentials to do it, but this is a place where you can actually sign on as faculty. And this will automate your income. So it's not just for things that, you know, we do directly, it's also it's a place to serve the profession. But if I search for New York, this is going to tell me all of the coursework that is approved for CE credits in New York. I don't have to worry about asking anybody. Now, when I'm done with these courses, all right, I'll be able to get my certificate, and my transcript is actually stored in here. Right here, I can log in, and this area right here, accounts and operations and transcript. Okay, these are, I can print my transcript, I can print my certifications, I can do all of these things, and it's all in one place. Right, so let's double check this one more time. Nope, still not working. Anyway, being the best of the best is really all about this. So what I want to really take the time to get into your head is that I can only help you build your practice if you're working at a level that surpasses everybody in your community. That's where I operate best. Because if you're not really cool or interested in tooting your own horn, I'll do it for you. But you have to have some basic understanding of the science behind what you're doing as a chiropractor. You, as the provider, you as the chiropractor, should understand chiropractic better than anybody else on the planet. That's your profession. That's what you went to school with. From a professional standpoint, that's who you are. And you should be proud of it. And you should be proud of the people you help. And you should be pissed off that we're only seeing 8% of the population. That should keep you awake at night. But it shouldn't irritate you to the point where you're angry or you're dismissive. It should irritate you to the point where you want to teach and educate. Because remember, when it comes to this program, those 3 pillars are important. The 3 pillars are getting somebody's attention, educating them, and then socializing with them. That's what we do with MDs, urgent care centers, hospitals. Let's get their attention. Then let's show them some research. Let's talk about what we do. Let's talk about the objectification of spinal biomechanics and how it can be fixed, it can be diagnosed, and how if we could manage that, we would get rid of all of the needless scripts for opioid medication. We'd get rid of the needless surgeries. We would improve surgical outcomes because patients are biomechanically balanced. Okay? Those are all really important parts of what you do as a chiropractor. I don't want you to sit back and take handouts from people. You don't deserve that. You're a doctor. Okay? And you have a specialty that's super important. Everybody has low back or spine pain at some point in their life. Okay? It's everywhere. It's ubiquitous. And we're the profession that can manage it. The rate limiting step, and this is what I always look for in an equation, right? What's the one thing that'll slow down the most complex equation? That's your rate limiting step. The rate limiting step is you learning. But learning things that are going to actually put patients in your office. That's what the academic marketing behind what we do is. That's why it's so important, and that's why it's so unique. Okay? So go to, this is on Dr. Student's program. So it's doctorspi.com. And you click on Become a Trauma Team Member. You look at the current or the requirements. That's where you start. All of these things are at the teachdoctors.com. You can take all of these courses, and all of these requirements are all housed here. If you want to learn more about each course, okay, you can come here, search for, let's see, Academy of Chiropractic. Search here, and let's just say you want to learn about MRI spine. Click on that. That's the 25 credits, and it will tell you all of the course description here. This is what each one does. It's all in there. Start learning where you can learn from. And it's not just some other chiropractor's name that he taught MRI interpretation at the Florida State Chiropractic Association. No, this is Bob Peister, neuroradiologist, Harvard trained. When you can articulate those things to medical doctors in particular, you're not like all the other schmoes in your community. That's your easiest and your quickest shortcut to building relationships, is having expertise. Okay? All right, I'm going to leave it at that today. I will open this up. If anybody has any questions, just raise your hands, or you can chat me with questions down at the bottom. I'll just hang out here for a few minutes, and then we'll kind of go from there. Remember, October is going to be the biggest seminar that we've probably ever done. This is going to be all talking about Wall Street and building clinics across the country with surgical suites and hospitals. This is happening at a very, very high level, so just make sure that you're there. Okay, if you don't have to do anything else between now and then, that's a place that you need to be. Then also understand that if you need me, I'll generally pick up unless I'm with somebody. If I'm with somebody on the other line, my answering service will answer and just schedule an appointment to meet me. Okay, whatever is good for you. My staff has access to my calendar. All right, it's real easy, and I've been doing that for a couple of weeks, and I'll tell you, it works really, really well. I don't have to rush anybody. I don't have to push anybody off. I can spend time with all of you. So consider using that, all right? Okay, any questions? All right, guys and lady. Thank you very much. You guys have a wonderful afternoon, and there is not going to be a seminar next weekend. I have a big meeting with one of the surgical reps for a surgeon that I work with. But then we'll resume probably after Labor Day. I'll send out an email. So it'll be a couple of weeks, probably 2. All right? Thanks so much. Bye-bye.